Knock, knock.
Hi,
Hey, how are you? How are
good.
you, Samantha?
I'm very good. And
That's
how
good.
are you?
Yes, my name is Camilo Gilabert. I am the treating physiotherapy today. Um, just to know that I'm with the right patient, Samantha, can you please confirm your full name, date of birth, and age, please?
Yes, I am Samantha Smith. I'm 35 years old. My date of birth is the 13th of July of 1990.
All right. Good,
Mm-hmm.
good. I got a referral from your GP saying you were complaining of lateral elbow pain on your right side.
Correct.
Um, the diagnosis was of lateral epicondylitis. Is that correct?
Yeah, I
All
started with
right.
this pain like about 3 months ago. Yeah.
Yeah, it's been happening since 3 months with a pattern on and off as well. Is that correct?
Yeah, yeah,
All
sure.
right, good. I also got that there is an ultrasound done, an image done, and they found like a sort of
Damage in the.
yeah, sort of fluid as well in the insertion site of the lateral epicondyle muscles there on your right elbow. Is that correct?
Yes,
It's
correct.
something else that they found, or you can remember from that
Um,
you can recall?
no, it was a
No?
damage in that, yeah, in the area. Here they explain like my
Beautiful, all good then.
like tennis something, tennis elbow.
Yeah,
Okay.
it's called usually what it's called tennis elbow. It's the patient's complaining of lateral epicondyle pain,
Okay.
which is the side of the right side. Sorry, the lateral side of the elbow.
Okay.
All
Yep.
right.
Yep.
I also have in your file that you are a plumber. Is that correct?
Yes, I'm a plumber.
All right.
Yeah.
All right. Before we can go ahead, may I please confirm with you if you have any other medical condition?
No, I
No?
don't. No,
Not at all, like heart problems, diabetes,
no,
anything that you can recall?
no.
Not at all. All right. Are you taking any medications at the moment?
Um, no. At the moment, no, not
All
at all.
right.
No,
And what about the GP? Did he prescribe some pain meds or something?
no, no. I just took like before some anti-inflammatories, but I stopped it.
All
Yeah.
right. You
I
have
was.
been taking these anti-inflammatories by yourself?
Well, yeah. When I started, yes,
All right. When it started, but you already stopped it?
yes,
Stop them? All
yeah,
right. Good. All right, Samantha. I know that you told me you work as a plumber.
yeah.
Um, I'm just wondering how is that job going? I mean, are you on leave? Are you doing some light duties? What are you up to now?
Yeah. No, at the moment I'm still working.
All right.
But it's the pain is very extreme when I finish the day.
All right.
So in the morning it's like not too bad, and then the night is it's just so bad. It's
All right.
burning.
So morning is not too bad,
Yeah.
and then the night it's not good at all.
No.
All right. It's each day is the same, or any day that it's
No.
like better during the night or
No,
something like
like
that.
like depending of my task. If I have a lot of work to do with heavy tools,
Mm-hmm.
it's very bad. It's like I don't know.
All right.
It's like between 8 and 9. They've been asking me for this
Mm.
number, so I know now.
Right, that's fine. I just want to make sure we are talking in the same, we are in the same page.
Yep.
You can see here that I brought you here this, which is our visual analog scale or numeric rating pain scale,
Yep.
which goes from 0 to 10.
Okay. Yep.
0 means that you don't have any pain at all, and 10 is the worst pain that you could imagine in your life.
Yep.
Which is your worst pain that you have ever imagined or
Yeah.
you
Yeah.
have ever experienced?
Yeah. I got it. Yeah.
You know, what is your worst pain at the moment?
Are you
I
asking me
mean,
for?
I'm sorry if it's not clear. What has been your worst pain in your life? Like, have you ever broke any bone or something?
No, not really.
No?
No.
Can you think of something that was so painful in your life?
Well, when I roll my ankle, like
Mm,
that specific moment.
well, let's say that maybe that's is your 10 or something that is really the extremely painful is the 10.
Okay.
All right?
Yep.
So 0 nothing, 10 is the worst pain. I just want to know how is the pain when you are not moving your elbow or your wrist or your arm.
Mm, like two.
So a rest it's two.
Yeah.
Then
If
what happened in the morning when you the first time in the morning
when
when
I
you
start
woke?
to do something that it's very light stuff, like lifting like 2 kilos is like two or three,
All
two or
right.
three.
Then with
Then sorry,
light
pardon.
movements like three to four. All
Yeah,
right.
and when it's like a heavy gripping, like some tool is like very heavy, it gets very bad. Like it can go up to 8 and 9.
8 to 9.
Yeah.
All right, 8 to 9 out of 10. So probably that 8 and 9 out of 10 is while you are using your muscles.
Yeah.
And what about when you told me that at night is worst? What do you mean by worst in the night? What is your pain at night? How would you rate it?
Yes, like as I told you, like no at 9. It's just at the end of the day.
Ah,
At
that's
the
the
end
end
of
of
the
the day.
day,
All
like
right.
especially when I'm working.
All right. So, all right. I'm making a picture. So, it's clearly, I can clearly see that what produces your pain is obviously using your gripping or lifting heavy tools.
Yeah.
How much are they tools? What is the weight of these tools? Are
I don't
average?
know. I would say maybe I don't know. We have screw that is like it's not too
I
heavy.
mean, the screw is not too heavy, but what about the things that needs to be screwed? Are you tighten up like heavy things or?
Yes, like yeah. Are you asking me about the tools or like?
Yeah, let's talk about the tools because the tools how
Uh,
much that do they weigh?
I don't know,
Usually
like
my
three,
driller,
4. But like it's the
yeah,
repetitive movement, the gripping. Sometimes I need to like
hold
press
on there.
a lot, and like yeah, it's hard to say, but it's yeah.
Yeah, it's a bit of a awkward
It's like
question, I know.
because it's like a different tools depending of the job.
All right, so we have tools, we have repetitive movements, and also gripping.
Yeah, a lot of gripping. Yeah.
Yeah, cool. And may I ask you, what eases your pain? Is there anything that you are doing at the moment that eases your pain, or I don't know, putting cold, putting
Uh,
hot packs?
when I'm working, like I usually like squeeze here. I like when I do this, it's kind of like relief a little bit,
Cool.
and try to stretching sometimes like that.
All right.
And when I'm at home, I put some heat.
And that relieves your pain?
Yeah. So that's pretty much what I've been doing. Not
All
sure
right.
if that's correct or not.
I mean, this question that I'm gonna ask you sounds logical, but what is this epicondylitis or this tennis elbow stopping you to do from your daily life?
Um, well, at the moment I'm still working.
Hmm.
I'm doing like more like light duties.
All right.
Uh, so starting from work because I cannot performance like I
Mm-hmm.
used to. But yeah, like work. I used to go to the gym and now I cannot because I don't really want to overuse.
Cool. And that was going to be my next question in regards to your hobbies. What your hobbies are?
Yeah, like going to the gym. Um,
Weightlifting,
yeah, I
or
usually yeah.
are you a runner? Are you a weightlifter?
No, like I like to weight lift. But yeah, yeah. It's not like I do it because I like to keep fit.
And have you been doing this gym the same routine for the last time, like for the last
Yeah, it's nothing
six
new.
months?
Yeah, it's
There is
nothing new.
nothing new, like any weight change. You have put more weight on, put more load on your upper limbs or something like that.
Sometimes yeah, I like to challenge myself. So probably yes.
Mm.
So this is why I stop it too. Because my job is also very physical.
Mm-hmm.
Yeah.
Got it. Got it. I can make my picture about that. Is there anything else that this pain in your elbow is it stopping you to do apart from gym, apart from the regular work?
No, like
No.
yeah,
All right.
my sport and like the job half of the time, and I need to work like I don't really want to risk to like start to be out
Mm-hmm.
of job or work part time because I yeah you know.
Yeah, in regards to your job, in your working site, you told me you are doing some light duties at the moment,
Mm-hmm.
which is obviously something that I highly recommend to try to offload a little bit, try to reduce the load of that muscles and tendons, which
Yep.
is something good. But yeah, do you think you can keep doing that sort of work, that sort of light work, without having much pain at the end of the day?
I don't know because I like 2 weeks ago I stopped work for 2 weeks
Mm-hmm.
thinking like okay if I don't work and if I
It's
have
gonna be
a
better.
proper rest and it get worse. It get
All right.
worse when I come back. It was like nah,
And what about these light duties? What does this light duties involve?
like less gripping task, less tools, heavy tools. So like
All right.
I'm doing like literally like light stuff, like so easy
And
stuff.
what about night after these light duties? Are you getting soreness as well? Same
No, a
eight
little
out
bit
of
less,
10?
but it's still like very uncomfortable, and so I'm scared to like getting worse. So
All right,
I don't know
fair
what to.
enough.
I don't know what to do.
Um, if you could rate now after your light duties your pain, how is it at night time after working in these light duties? How would you rate
Um,
it?
no, I still like 7, 8.
All right, so it doesn't
Yeah,
change them too much, to
yeah,
be honest.
yeah,
All right, fair enough. That's great. I just want to rule out some red flags.
yeah.
The GP told or write on the referral that you were having some numbness,
Mhm.
tingling.
Yeah.
Are you?
No, not really.
Not really, no numbness,
No,
no tingling,
no.
pins and needles, any burning
Um,
sensation?
yeah, a little bit, a little bit.
Burning sensation?
Yes, on the night time. Yeah,
Burning sensation
yeah.
and shooting pain?
No, more like yeah, burning sensation.
A burning sensation. And are you feeling like fullness in the area, like pressure like pain or
Yes.
pressure like sensation?
Yeah.
Does this pain goes somewhere, like radiates
No, no
upper in the limb,
radiation.
or there is any radiation down to the
No,
arm? If you can see my hand, um, is this radiating to this side of the hand or this side of the hand,
no,
your
no,
right
no
hand?
radiation.
No radiation
No,
and no sensitivity alteration. There is no changes in the feeling of your upper
no, no.
hand, sorry,
No,
on
it's
your
just
hand.
here.
It's just localized there.
Yeah, like a burning, but like here.
All right.
Yeah.
You are not having any problem. This is going to be like a sort of awkward
Mhm.
questions, but it's just to double check there is nothing else coming up. All right, going
Yep.
around. So you haven't had any problems like swallowing. You haven't had night sweats or chills or
No,
not
no,
at all.
not at all.
All right. You haven't had cough. I don't know if I asked you about
Mm.
cough.
No, no cough.
No?
No.
Any problems in your limbs or apart from obviously to your elbow? Any weakness on your side?
No.
Any changes in the color of any part of your skin or body?
No.
Unexplicable bruises?
No.
No? Okay. Sounds good. Not bowel and bladder problems as well?
No.
Alright, cool. Not pain, not unremitting pain apart from this guy
No.
here. That is obviously it's part of your main complaint. All right, good. I think we have all the information in regards to the questions that I needed to ask to you. So now I just want to have a look to your elbow, please.
Yeah.
All right. All right. All right. May I touch your skin? Is that all right for you?
Yeah, go for
All
it.
right. Does it say if you have any bruising here, any change in the color?
No, not
I
at all.
can't see nothing at all.
Mm-mm.
There is no change in the color, and I can't see swelling, to be honest, compared to this side. I just want to make sure. There is no swelling, apparently. There is no change in the color and the muscle tone. The muscle bulk doesn't seem to be different, so there is no atrophy, evident atrophy from your muscles on the lateral epicondyle. Same with the medial bulk muscles. There is nothing that calls my attention. So that's good. Just want to check, does it feel same?
Yeah.
Does it feel the same?
Yeah.
Yep. Does it feel the same?
Yeah.
Does it feel the same?
Yeah.
All right. Can you close your eyes, please, and let me know if your thumb is up or down?
Up. Down. Up. Down.
Beautiful. What about here?
Up. Up. Down.
Good. Good job. Um, would you mind showing me where your pain is localized?
Like here. Or
All right.
here. 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 Here.
Try to do something with the finger. With your finger, show me the area where your pain is localized.
With the three finger. Would
If
be
you
like
if you can
there.
make a circle.
Like this.
All right. So your pain is localized here.
Yeah.
You don't want me to write a graffiti for you?
No, thank you.
All right. Just let me get some palpation here.
Yeah, right there.
All right there.
Yeah.
All right. Yeah, there is some cracks here. Not cracks. It's, how do you call?
Reputation.
Crepitations could be, but crepitations could be something more related to bone. So
What do you mean?
yeah, bumps, sort of bumping sensation here that could be something related to muscle contractures or muscle spasm.
Okay. Yeah.
All right. So that's what I'm catching here. Yeah, there is a little bit of muscle spasm here, which is something that we can obviously expect from. I know this is painful. Probably just the fact that I am touching you, it's giving you like a high rate of pain. Is it?
Yeah, like when you touch it here.
Here
it's
is
like,
worse.
yeah, that's.
All right. So
like
the
here.
closer to the bone is worse.
Yeah.
All right.
But
so
here is kind of like it's a pain that it feels like sort of nice, like.
all right. So what you are telling me is like doing this is reliever for you. It's
Yeah.
a sort of relief of pain,
It's
and
like
this
painful, but it feels good.
feels nice.
Yeah,
Is
I
it?
don't know.
All right. Good. Yep. Let me check. Can you please, with your left arm, can you please bend your elbow, please? Sorry, just the elbow, and push my hand, please. Push my hand. Good. With your hand, push my hand. Good job. And push my hand. One more time. Beautiful. Can you please put your hand inward and outward, and I'm going to resist this. All right. Beautiful. Good. We're going to do the same with this one. All right.
Okay.
Can you please flex your elbow? Beautiful. One more time, please. All right. And push my hand. Yeah, it's so painful.
Yeah, that is annoying.
All right. That's all right. You don't need to do it anymore. All right. What about your wrist flexion? I just want you to put your arm up. Up.
I
All
can
right.
feel the tension there.
All right. I bet you are. Yeah. Let's say 2 fingers, and that could be like a sort of a 3 plus.
Yeah.
All right. What about the extensors? Can you please raise your hand?
Yeah, I can feel it like that.
I know. And that movement raises your pain too.
Like now, just like between 5 and 6.
All right, cool.
'Cause
What
I'm
about
not-
now? Try to push my hand.
Yeah, 6, 7, even.
All right,
When I try to push, like it's even like.
that's okay. That's okay. Now try to put the palm of your hand down and up, please. Good job. Beautiful. All good. There is a small amount of weakness in your in your extensor and flexor muscles, which is something that is expectable after like 1 month of being not being able to use too much your elbow and your wrist, which is something that we are going to expect.
Yeah.
Probably I would rate it like a 3 plus or even a 4 could be. It's just moderate resistance.
Yeah.
There is no alterations in the sensation, which is good. There is no problems with the proprioception, which is good. From what I can see, the only problem that I'm seeing now is that there is a sort of overload on the tendons of your extensor muscles of, your right elbow.
Okay.
All right. I just want to make sure you have all the information for that. The thing is, what I'm seeing now is obviously the same as the GP is a lateral epicondylitis, and what is that? It's basically that we put too much load on your tendon of your epicondyle, and that are the muscles that goes do the extension of the wrist.
Okay.
All right.
Yeah.
These muscles here, we put too much pressure, too much load, too much load on the muscles and the tendon.
Mhm.
So basically,
what is the name of the muscle?
Sorry, the extensor muscles of the right elbow.
Okay.
All right.
Extensor muscle. Okay.
Yeah, the extensor compartment on the right side of the lateral side of your elbow.
Yeah.
Basically, what we need to do now is start loading again your muscles there and your tendon, and for that we are going to start building up, because tendons like to be loaded, but the thing is that what we need to do is try to manage that load and try to pace it, or try to make it step by step, not loading all of a sudden.
So progressive load.
So like a sort of progressive load, and we are going to start building on that to make first of all your muscles stronger, but at the same time we need to make your tendon stronger, and at the same time a third thing that we are going to do is try to make all the fibers of your tendon a little bit more straight. Because what happens is that sometimes when you pull too much, the fiber starts to heal in a really random pattern. All right, let's imagine like that. So what we need to do is try to pull a little bit, put some load on the tendon, so the fibers starts to heal and start to position themselves in a more straight pattern. All right, and that's gonna give the tendon more features of being able to resist the load.
Okay.
All right.
Makes sense. Yeah.
Cool. What are we gonna do is the first thing that I want you to do, or we are going to do now, is doing some isometric exercises.
Mm-hmm.
Have you heard of isometric and eccentric exercises?
Yeah, a little bit. Would you mind if you pass me that?
This thing?
Yeah.
Are you cold?
A little
Are you
bit.
cold?
Yeah.
All right.
So yeah, isometric, and what was the other one?
The eccentric exercises. Have you heard about that?
I think I do. Yeah, at the gym sometimes I hear, but I'm not too sure.
You are not too sure. No worries. I will explain easily with this thing.
Okay.
So, basically, you have your muscle here. Let's put it in numbers. The muscle could be doing his action or the action by just contracting itself, but having no movement in the joints. What does it mean? Have you seen Popeye before, when he shows the bicep bulk muscle? Have you seen him doing like that?
Yeah. Okay.
Okay, this is an isometric contraction of the biceps, the brachial bicep. What does it mean? We are having a contraction, an active contraction. You can see that my muscle is working there, but there is no movement in my elbow or my shoulder.
Okay.
All right. So this is an isometric. So the muscle is working. There is active contraction, but there is no movement in the ends.
Okay.
All right. That's the first one. And the second one is going to be the eccentric one. And the eccentric one means that it's called eccentric because the ends of the muscles is going away, is pulling apart while the muscle is working. So what does it mean? If you think about the same muscle, the biceps, it's having a contraction, an active contraction, but it's going in lengthening. What I mean by that is that each end of the muscle is pulling apart, it's going apart.
So stretching.
It's not a stretching.
What's the different end?
It's a different thing. It's a muscle contraction. There is active muscle contraction. The muscle is still working there. That is still having contraction, but during the lengthening of the muscle.
Okay, yeah, makes sense.
All right,
Yeah.
makes sense to you?
Mm-hmm.
All right, so that's the second one, and the most important one is the eccentric one. All right, so there is a muscle contraction while the muscle is being lengthened.
Okay.
While there is having a lengthening of the muscle.
Okay.
All right, and that's the most important exercise that we are going to do to build up on those, like sort of regain the features of being able to resist the load.
Okay. Yeah.
All right. First one, isometrics, where we're working on that to relieve the pain and start working on the muscle strength. All right, but the second one is going to be like the gold standard for treating your tennis elbow.
Okay. Yeah.
All right. Cool. Having said that, what are we gonna do now is take this beautiful dumbbell that we got here.
Yeah.
All right. And I want you to lift your arm from there, holding the dumbbell, and hold that for 10-15 seconds. If you start feeling pain there, it's all right. Pain is not bad, but I don't want you to go over 5.
Okay.
All right. So if you start feeling over 5, put it down, have a sort of a rest, and then start again. All right. Your elbow. It's hurting.
My shoulder.
Your shoulder is start hurting.
Yeah, like it's heavy.
It is heavy. Let's try with a different one, which something that is not heavy. Maybe this dumbbell here, which is not too bad.
Yeah.
It's like
Should I
half
hold
a
my
kilo.
arm?
Yeah, you can do that.
Okay.
Doing some. How is the pain there?
It's better.
Better. Good. Now you can put it down and have a sort of a rest.
Mm-hmm.
All right. One more time. Let's say you're going to do this 5 times.
Yeah.
And sorry, 10 times, and holding for 5 seconds, between 5 to 10 seconds.
Okay.
All right.
Mm-hmm.
Cool. Do you have any question with this isometric exercise?
Just like holding this position or like that?
Hold in this position. It's fine.
Not like that?
No, nah, just straight.
Okay.
I'm happy with that.
If I get tired here?
What you can do is I'm going to show you the next exercise because I don't want to overexert your shoulder, and that's fair of asking. Just let me pull my bag here. And I just want to show you. And I just want to show you that there is some exercises here that we can do on the side of the table. Can you please put your elbow and your wrist at the edge of the table?
Yeah.
Cool. So, are you gonna hold your dumbbell here and just hold it there? All right. This thing is putting some load, control load on your muscles, on your tendon there.
How much is this?
It's half of a kilo.
Okay. I don't have this at the gym.
Do you have any rice bag at home?
Yes, I do.
Yeah, you can do a rice bag.
Okay, cool.
All right. Or you can do like I don't know, a soda can, or what else you can have. A bag of
a bottle. Like
a water bottle could be, you know.
Yeah.
All right, sounds good to you?
Yep.
All right, if the load is too much, meaning that the pain is over 5, reduce the load.
Okay.
Reduce the weight of the thing that you are lifting.
Okay.
Okay?
And always
That's the
keep that position.
Keep that position 10 seconds and that's gonna be fine. And doing this exercise for at least 10 times, 15 times, all right, until you start feeling pain.
Okay.
All right?
Yep.
If after the exercises that I'm going to give you at home, you start feeling again pain over 5 or 6, that's also indicative that we put too much weight on your muscles there.
Okay.
All right.
Yeah.
So I want you to unload that and tell me on the next session, so we can manage that load on your muscles.
Okay.
All right.
Yeah.
This is the first one. You already did 10 repetitions of this one, and the next thing that I want to show you is the eccentric one.
Okay.
All right. Same dumbbell. What are you gonna do is bring with your left arm. You're gonna bring your wrist on extension. I don't want you to start working yet these muscles, so relax the muscle, relax. Good, cool. So I don't want to start contracting the muscles yet. There, relieve, no muscle activation, please. Yeah, now there is no muscle activation, and now
I
you're
cannot
going.
hold this if I don't press it.
You don't need to hold it. You don't need to hold it. What I mean by that is that your left hand is going to do all the job to make to take your wrist into extension.
Yeah.
And then you're going to start activating your muscles on the lateral side.
Okay.
You know what I mean? Are you getting my point?
Yep.
All right. Let's try one time. All right. All the way down until you start feeling some pain over 5 or even over 4. All right.
I don't feel any pain at the moment.
Beautiful. So no muscle contraction, and now you're going to hold that. Beautiful. Go down. You see that the muscle is working, is being activated, but in a lengthening position. Okay. Going up is going to be passive, meaning that we don't want muscle contraction, and going down is going to be controlled by these muscles here. Okay?
Yeah.
Are you getting my point?
Yes.
Beautiful.
How many of those?
We're going to do 3 sets of 10.
Okay.
3 sets of 10.
I don't know how many I do have, but I think I will do one more.
Cool. Sore?
Not really.
Not
no.
really.
Just tiredness of my muscle.
Yeah, well, the muscles are going to be tired, are going to be more easy to fatigue, which is something that we can expect of your present condition. But we are going to work on that. All right?
Yeah.
If you told me that you squeeze your muscles on that side, that's fine. That's something that I want you to keep doing at home as much as you can, but don't go over the bone here. All right. So keep away at least 3 to 4 centimeters where the muscles are. Just where the muscles are.
2, and then here.
Like three fingers.
Yeah, actually, that's the place that I like to press.
Cool. So that's cool. That's something that you can keep doing at home.
Yeah.
Maybe what we can do is just build a routine, like doing the whole set of exercises, isometric, eccentrics, and then try to relieve the muscles there. All right? And that's something that you're going to do like 3 times a day during all the days.
Okay.
All right?
Yep.
Cool. I just want to work on your pronation and supination. That means pulling your hand up, your palm up, and your palm down.
Yep.
All right? So I'm gonna give you this small dumbbell, since there is no much.
So the same dumbbell or bigger?
Now this is a little bit bigger. Let's say this is 1 kilogram,
Okay.
and I just want to make sure or assess how do you do with this weight. All right, so we can go back if it's too heavy. All right, palm up and palm down. Mm-hmm.
10 times 2.
10 each side, and it's gonna be 3 sets of 10 as well. Are you okay?
Yeah.
Had a bad night last night?
No,
Not too bad?
it's been a big day.
It was a big day today.
It's been a big day, yeah.
All right. I bet you met a friend today who is really annoying. No?
It was what?
Annoying? You came to a friend's
No.
house that was annoying?
No.
Just kidding.
Yeah, 10.
All right. How are you feeling now?
Yeah, good.
How would you rate your pain now?
Would be like, yeah, 5.
5?
Yeah, surprisingly
Better?
not better.
Same? Worse?
Yeah, but like at least I'm working on my muscles.
Yeah, that's good. That's something that we obviously want to make sure it's happening.
Yeah, because I
Alright?
feel like getting like week and week.
Yeah, sure thing. So just want to make sure I'm gonna write this down for you. First exercise is gonna be the isometrics.
Yeah.
Second one, eccentrics.
So 3 of 10 each of those, right?
Yes.
Okay.
And in regards to the isometric, which was the first one that we did, I just want you to hold for 10 seconds.
Okay.
All right? If you can hold
10
less than
times of 10
10
seconds?
times 10 seconds, and that's gonna be one set. If you can do 3 sets of the isometrics, that's good.
Yeah, okay.
All right, then the eccentric one, which was the second one, with the dumbbell, the small dumbbell or the rise thing, going back. You remember that?
Yeah,
All right, that's gonna be 3 sets of 10 times.
okay.
And then with another dumbbell.
So 3 exercises, cool.
All right, 3
Should I do it
exercises.
like after work?
I recommend you to keep doing your light work, not start reassuming all your duties, like don't overexert your muscles. What does it mean? You can still working if it's going to be like light duties, but I don't want you to go over 5 out of 10 on your pain. All right, if you feel like you are doing too much, I need you to stop doing that.
Yeah, okay.
All right.
Yeah.
And at the end of the session, you're going to start squeezing a little bit, giving some deep massage on your muscles
After the exercise.
after the exercises.
You're gonna give me a...
Yep, I'm gonna show you how to do it now. I'm gonna do it to you, and yeah, because I need to.
That's my dream, you know?
Your dream have been released by a physio.
Exactly.
Oh well,
That's my favorite part.
that's your favorite part.
Yeah.
Good. Good, 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 good. All right, let me get some cream here. A lot of cream. Beautiful. Good. There you are.
Yeah,
All
it's
right.
like a painful and blah blah.
It's so painful. I know. We're going to do some, what is this called? Petrissage. Effleurage. This is effleurage.
Flash.
Effleurage.
What is this?
Effleurage.
Why for?
It's effleurage.
Okay. Like
It's
kinetic
effleurage.
sir?
What was that?
Kinetic sir?
Kinetic, sir. It's effleurage. Effleurage. Then we're going to do some transverse movement of the muscles. So good. This always felt so good.
I know. Should I try some dry needling?
If you want to go over somebody that knows dry needling, that's fine.
Okay.
I'm not qualified. I'm just a entry level physio.
Okay.
But if you are happy to try dry needling, I can make you a referral for a good one that I know. Do you want to give it a shot?
You think could be beneficial?
I think we should try with this treatment first to give it a shot to the treatment,
Okay.
see how it goes for 2 weeks. If there is an improvement, keep on that. And if there is no improvement, we can start thinking out of the box. How does it sound?
Yeah, good.
Sounds good to you?
Yep.
All right. Then we're going to do some circles. And if you find when you're doing these circles that there is some tender point, keep there.
Like there. Can you feel it?
Yeah, I can feel it. There's a bump. Beautiful bump there.
Should I press it or is that dangerous?
No, it's alright if you press it, but do not over press it.
Oh.
Do not produce, I don't want you to squeeze so hard your muscles that you start.
It's kind of like I like it.
Yeah,
It's like it's painful, but I like it.
it's a sort of a nice pain. I know.
Because it's relieving.
It's gonna relieve your
After.
the compression around. So at the same time, here there is some nerves that runs through, obviously, from your neck down to your shoulder, elbow, and hand.
Yeah.
And because there is some inflammation here, it's obviously that there is some compression of the nerve as well.
Yeah.
All right, but I couldn't catch any nerve entrapment so far. I just want to make sure we are going to put some traction, some load, and distraction on your nerve, radial nerve, specifically because it runs over here.
Yeah.
After this, so yeah, that's the last exercise that I want you to do at home, which is called the nerve glides.
Okay.
All right, should last like, I don't know, maybe 5 minutes. Your massage, it's gonna be okay. Put some cream there, make it nice. This is real life. This is real, this is true.
Yeah.
She's having a really
Hi.
a really painful lateral elbow. Yeah, I'm not gonna go
I like it.
too far. All right. There is one more thing that we're going to do, which is called a nerve glide.
Yeah.
All right, nerve glides, as it names, it's a glide of the nerve that runs over the lateral side of your elbow.
Yeah.
All right, the name of that nerve is the radial nerve, and sometimes get entrapped or get compressed.
Radio. I remember this is the antenna.
Radial, because it has two.
This is the antenna.
Yeah, this is the antenna. Radial, that's good. And also I remembered radial because it has only two syllables. Radial, cubital.
Oh,
Yeah, we learned something today. That's great. So radial and cubital. Good. All right. Ta-da. All right, beautiful. Yeah, so nerve glides. So
Okay.
what we are going to do is put your elbow at the side of your body,
Yeah.
like that. So your hand needs to be looking downwards.
Yeah.
You're going to flex your fingers. All right,
Fingers or the wrist?
wrist and fingers as well. Everything.
Like this?
No, flexing like that.
Okay.
All right, and put it at the side. And what you're going to do is mix it up with a elbow flexion and lateral flexion off to the contralateral side.
Okay.
Why is this happening, something like that? Why this movement is a little bit awkward? It's because the nerve comes from here, from the lateral side of your cervical spine.
Sorry. Same side?
Yep, same side.
Ipsilateral.
Likewise.
Like this?
Yep.
Or like this?
No. Always like that.
Okay. So
Like
going
that.
here.
Yeah,
That way.
like
So
that.
put tension.
Like that.
And then I relieve tension
Like
here.
that.
Like that.
Like that. Think that there is a strap here. There is a line here holding tight. So each time that you go that way, you need to pull that way. If you go this way, you need to pull this way.
And I move my neck is so stiff.
All right. This is called nerve glides. If you can do this 10 times,
Oh my god.
that's fine as well. Remember, the number 10 is the key here.
Yeah.
All right?
Yep.
So let's summarize. isometrics, eccentrics. Then you're going to do
Mm,
the pronation and supination exercises.
yeah,
Then you're going to do some massage and nerve glides.
that's great.
All right? How does it sound?
Good. So
All
five
right.
exercise.
Yes. Can you please put your arm here? Your right arm here. I just want to recheck how did go the session today. So I just want to know how is your pain now?
4.
Good job. Good job. Yeah, can you please bend your elbow for me, please? Oh, same range. Great. Beautiful. What about the wrist flexion? Beautiful. And what about the resistance here? Oh, much better. Much better. All right. No, you're doing so good. All right, what about here? Can you please extend your wrist?
Yep.
One more time, please. Improved a lot. The strength improved a lot. This is definitely a 4, so it was much better than what I saw before. So it's good. There's 3 outcome measures that we had: pain, range of movement, and strength. Improved.
You're the best.
Yep, and plus confidence. You are a little bit more confident. You already got your home exercise program. You wanna push me? All right. So, do you have
So
any question?
weak.
Do you have any questions for your physio today?
Everything is very clear.
All
Just
right.
want to apologize with Van to do this, but we're tired.